This is my evidence-based practice proposal slideshow. The purpose of this evidence-based practice proposal: in June of 2022, a decision was made that Roe v. Wade was overturned, and thus leaving the decision up to the individual states, making it illegal in certain states to have an abortion after a certain period of time. This has caused at least 25 clinic closures across the United States and at least 40 clinics to limit their scope of practice. Long-acting reversible contraception, such as an IUD or Nexplanon, is one of the most effective forms of birth control today for people that may want to become pregnant in the future. But many nurse practitioners are not trained in how to do this. Many nurse practitioners are practicing in primary care, where many patients seek advice on contraception. My evidence-based practice question is: how can nurse practitioners provide contraceptive care to patients to decrease unintended pregnancies? A review of the literature. In a study done by Moore, surveys were sent in the mail to providers in Illinois, and it was found that healthcare providers felt confident about providing care to adolescents in Illinois, but that only 54% of these providers were comfortable placing a long-acting reversible contraceptive device. In another article, it notes that 4 United States-based universities added hands-on experience placing long-acting reversible contraception in practice and were able to get their students certified so that they were prepared to practice once graduated and able to provide this necessary procedure to many of their patients. My proposed change/intervention. The study will be used to determine providers' knowledge surrounding inserting long-acting reversible contraception. To make this determination, nurse practitioners will be asked questions using a 5-point Likert scale. The study will be used to determine providers' prescriptive on the importance of preventing pregnancy in women that desire not to be pregnant. It will also determine their perspective on importance in their practice and whether or not they would be interested in inserting intrauterine devices and hormonal implants. In this model, the identifying triggering issue would be unintended pregnancy in the United States, and the question/purpose would be: how can nurse practitioners provide equitable health care to patients to decrease the rate of unintended pregnancies? And that issue is a priority. The proposed project methodology. So the population is going to be 8 nurse practitioners that work at a community health center in Boston. The project will be to assess their comfort in providing family planning services to female patients who are established at the practice. That means that they've had an office visit in the last 2 years, ages 18 to 45, who are not currently pregnant and do not desire pregnancy in the near future. The study would include all female patients regardless of language, age, ethnicity. Nurse practitioners in this project are 28 to 50 years old and have been practicing for at least 1 year and have been at this actual practice for a year. Most nurse practitioners are practicing in primary care, whether that is new grad or a few years after graduation, which is where many patients will seek contraceptive counseling/advice for the first time. If patients have access to having these devices placed at their primary care office or at the actual visit where they're seeking counseling and advice, then this may lead to decreased unwanted pregnancies. It's especially important in the United States right now due to new laws that are being enacted. After review of the literature, there's not many articles or projects being done on contraceptive access in low-income areas, and it's an extremely important topic and one that should be addressed in the literature.